Hi everyone, today we are going to discuss the new topic that is prostaglandins. Prostaglandins are very important inflammatory mediators which are produced along with the histamine in our body, and prostaglandin, leukotriene and platelet activating factor. They together called as eicosanoid, and prostaglandin and leukotriene both consist of the 20 carbons, and they are derivative of the prostanoic acid. They are derived from the polyunsaturated fatty acid also, and these all are involved in the inflammation, swelling, redness, burn, itching during tissue injury condition. And actually, how these prostaglandins are produced in our body, it is they are synthesized in step by step process. So they are produced from the membrane phospholipid. In the presence of the enzyme phospholipase produces the arachidonic acid. Arachidonic acid is a unsaturated fatty acid, and this arachidonic acid either follow cyclooxygenase pathway or lipooxygenase pathway. Always remember that prostaglandins are produced by the cyclooxygenase pathway. Cyclooxygenase pathway is also called as COX pathway, and leukotrienes are produced by the lipooxygenase pathway, and leukotrienes are involved in the pathophysiology of the asthma. Then if we discuss about the cyclooxygenase pathway, prostaglandins are the main product of the cyclooxygenase pathway. So firstly the PGG2 is produced, and PGG2 get converted into the PGH2, and PGH2 in the presence of the isomerase enzyme produces the various type of prostaglandin, that is PGD2, PGF2 alpha and PGE2. And PGH2 in the presence of the enzyme prostacyclin synthetase produces the PGI2. And another important product of the cyclooxygenase pathway is a thromboxane synthetase. Thromboxane synthetase produces the thromboxane. Thromboxane synthetase, it is enzyme, and it is responsible to produce the thromboxanes. Then we will discuss about what are the roles of the prostaglandins in our body, and before that the different type of cyclooxygenase. Cyclooxygenase are available in the three forms, that is COX1, COX2 and COX3. So this all three are different. That is COX1, it is called as constitutive enzyme, means it is responsible for maintaining proper renal function or production of the gastric mucosa. It decreases the production of the gastrin or the other gastric juices which are responsible to cause the gastric ulceration. So COX1, it protect our body from the peptic ulcer, and COX2, it is inducible enzyme, means it is produced whenever there is inflammation, or in case of cancer cells COX2 is produced, and it is involved in the pathophysiology of the inflammation. And COX3, it is responsible for the perception of the pain, fever, but it is not involved in the inflammation. This is about the cyclooxygenase. Then next is the role of the prostaglandin. Prostaglandins, different type of prostaglandins act on the different organs by the various mechanism, like first is a blood vessel. Thromboxane A2 and PGF2 alpha, they are responsible for the vasoconstriction, and PGI2, PGE2, they are responsible for the vasodilation, and this vasodilation is mediated by the endothelial dependent relaxing factor, that is nitrous oxide. And PGI2, it is potent dilatory action. Then next is a platelet aggregation. Platelet aggregation means thromboxane it is responsible to promote the platelet aggregation. uh, Non-steroidal anti-inflammatory drug like aspirin, they inhibit the platelet aggregation by the decreasing synthesis of the thromboxane. But PGI2, it is responsible to inhibit the platelet aggregation, while PGG2 and PGH2, they promote the platelet aggregation. Means you can remember by the trick, that is PGI2. I means inhibitory, and inhibitory means it inhibit the platelet aggregation. And uh, next is a uterus. uh, uh, Remember that all prostaglandin, they prominently, they are responsible for the uterine contraction, because prostaglandins are produced during the parturition. They facilitate the childbirth. And during pregnancy, uterus is sensitive to prostaglandin, as well as oxytocin also increases the sensitivity of the uterus for the prostaglandin. And prostaglandin are involved in the initiation and progression of the labor. And prostaglandin are present in the semen also, facilitate the movement of the sperm in the female vaginal tract. And during dysmenorrhea means the condition of the painful menstrual days. During this, the prostaglandins are produced in more amount, and that's why it causes the pain. Then next is a bronchi. uh, Thromboxane A2 and PGF2 alpha causes bronchoconstriction, while PGI2 causes bronchodilation. Means wherever there is a PGI2 present, it is responsible for a dilatory action. Means in the bronchi, it causes bronchodilation. In blood vessel, it causes a vasodilation. And whenever there is a PGF2 alpha present, or thromboxane present, or PGD2 present, they are responsible for the contraction. So you can remember by the trick, that is PGD2, PGF2 alpha, they are responsible for the contraction, and PGI2 is always responsible for the dilation. Then next is the I. PGF2 alpha, it is responsible to decrease the intraocular pressure, and they increase the UV scleral outflow. Means PGF2 alpha analog lanatoprost and bimatroprost, they are used in treatment of glaucoma. uh, then kidney, prostaglandins, they have they are responsible to increase the diuresis. It is a combination of their natriuretic effect and aquauritic effect. Prostaglandin increases the loss of sodium, loss of water from the kidney, and that's why they have diuretic effect. And male reproductive organ, as prostaglandins are responsible for the vasodilatory action, like PGI2 is responsible for vasodilatory action, or PGE1 is also responsible for the vasodilatory action. They are responsible for the erection of the male reproductive organ. Then next are the uses of prostaglandin. Prostaglandins are used, their analogs are used mainly, that is mifepristone is one of the prostaglandin analog used in the medical termination of pregnancy. Then PGE2 analog, dinoproston, it is used for midterm abortion. Carboprost is also used for the midterm abortion. Carboprost is used to decrease the postpartum hemorrhage. And Jamiprost used for the cervical priming. Cervical priming means it facilitate the abortion. Then next is a glaucoma. In glaucoma, lanatoprost, bimatroprost, these drug are used. Then peptic ulcer, in the treatment of peptic ulcer, misoprostol is used. It is PGE1 analog, and PGE1 is responsible to increase the mucosa production. Then impotence in males, alprostadil is used. Then pulmonary hypertension, as PGI, means PGI2 is responsible for the vasodilatory action. Means it decreases the preload, it decreases the afterload. This drug epoprostenol, it is used in the treatment of pulmonary hypertension. Then prostaglandins are useful to maintain the patency of ductus arteriosus. Ductus arteriosus, it's responsible to supply the blood from mother to child during pregnancy. And patency means open. Patency means open. Means it is useful to save the life of the neonates with a ductal dependent cardiac lesion. Next is a leukotriene. Leukotriene is also one of the important inflammatory mediator. It is produced by the lipooxygenase pathway. The name itself indicate leukotriene means tri-in. Three triple bonds are present in the structure, and they are present in the lung platelets. Leukotrienes are mainly involved in the pathophysiology of the asthma. And LTB4, LTC4, LTD4 are various products that are produced by the lipooxygenase pathway. So LTB4, LTC4, LTD4, they act on the different receptor. Like LTB4 act through the receptor BLT1 and BLT2, and LTC4 and LTD4, they act through the receptor cis-LT1 and cis-LT2. As these leukotrienes are involved in the pathophysiology of the asthma, their effect need to be antagonized. So the name of the leukotriene receptor antagonist, it is important. Remember, it is Zafireleucost and Monteleucost. You can remember this name by um, uh, by the trick, that is their prefix is Leucast. Their prefix is Leucast. You have to only remember the initial part, that Zafiri and Monty. Then direct lipooxygenase inhibitor, that is Xylitol. Means this drug antagonize the effect produced by the leukotriene, because leukotriene are responsible for airways inflammation or production of the mucosa in airways. So this effect is antagonized by this drug. Then next is a thromboxane. Thromboxane is one of the autocoid type of substance. And as we know that thromboxane is responsible to enhance the platelet aggregation. But non-steroidal anti-inflammatory drug, they they are responsible to reduce the thromboxane synthesis, and because of that the platelet aggregation cannot occur. Then name of the thromboxane receptor antagonist are also important, that is daltroban and sultroban. So in this one thing that is important, that is during pregnancy or during parturition, when the pain is occurring, if non-steroidal anti-inflammatory drugs are given, this drug causes a delay of the labor, because the prostaglandins are responsible for initiation and progression of the labor. And non-steroidal anti-inflammatory drug, they completely they block the cyclooxygenase pathway. So it is advisable that non-steroidal anti-inflammatory drug are not given to treat to treat the pain during parturition. Then in this topic, the important part is what is COX-1, what is COX-2, and what is COX-3, which is called as constitutive enzyme, which is called as inducible enzyme. These two things are important. Then next, you have to understood what is the role of each and every prostaglandin, whether it is responsible for vasoconstriction or vasodilation, whether it is responsible for the bronchoconstriction or bronchodilation. And you have to remember that all prostaglandin, they are prominently responsible for the contraction of the uterus. Next is their uses important, their names are important, which drugs is used in the treatment of which disease condition. It is important, and here the name of the antagonist of the leukotriene or antagonist of the thromboxane receptor. These are important part in this topic.